With that, roll call, please.
So Francis Duncan,
Here.
John Bonaprise,
Here.
Reynolds,
Here.
Hale,
I'm here.
Tony Johnson,
Here.
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 Amy.
Here.
She's online.
Looks like she's
Here.
online.
She's probably got
I don't
herself
think she can
muted.
hear. I'm sorry, I couldn't hear you. I'm here.
Gotcha, thank you.
Can you hear me, friend?
Yes, I sure can, Johnny. Thank you.
Thank you much.
Okay. Well, with that, I'll entertain a motion then to approve the agenda.
I move for approval.
I'll second.
Okay, motion's been made and seconded to approve the agenda. Any discussion? Doesn't look. With that, I will call for the vote. All in favor, say aye. Opposed, same sign.
Aye.
Aye.
Hi.
Okay, moving on then to agenda item number 4, approval of the minutes for the December 10th, 2024 meeting.
So moved.
We have a motion made. Is there a second?
I'll second.
Second by Rita. Motion's been made and seconded to approve the minutes. Any discussion? Does not appear so. With that, I'll call for a vote. All in favor, say aye.
Aye.
Opposed?
Aye.
Okay, motion carries. Okay, agenda item number 5, public comment. We have 3 minutes, not to exceed 30 minutes total. Do we have any members of the public here today who would like to make any comments for us? No? Okay, does not appear we have anyone who would like to make any public comments. So then moving on to agenda item number 6, receipt of information from supervisors not seated as committee members. Looks like our supervisors are pretty much all committee members unless our county board chair has anything for us.
I'm seated, so I'm fine.
Okay, you're seated, so you're fine. Okay, very good.
I would dispute that, Jay.
Yeah, well,
Fine or not.
I might get some
Retribution.
right. Well,
Okay, then. So moving on, agenda item number 7 is discussion and possible action regarding resolution 01-25. This is a resolution to formally support the creation of an inpatient psychiatric treatment facility in northern Wisconsin. Mo.
Yes, this will tie into the next item on the agenda also with the crisis ad hoc committee we've been working on. This is a lobbying resolution for legislators for funding for a facility in northwest Wisconsin. This was passed by Chippewa County, so we jumped on to mimic that resolution.
Okay. Is there any questions about the resolution itself? And then maybe our discussion will carry into agenda item 8, which is the committee report. Do we want to look for some action on the resolution first?
Yes.
So with that, resolution 01-25, any questions or comments?
I have one. On line item 30, there's a Scribner errors that is corrected in the report.
Okay, search and replace.
Instead of Chippewa, well, it'll be Polk County.
The clerk is aware of it. She's already changed it.
Yeah,
so-
the clerk has changed
Okay.
that. Just so you're aware of what you're voting on.
Okay, very good. Brad, you,
Motion to approve.
okay, is there a second?
Second.
Seconded by Bill. Motion's been made and approved to approve resolution 01-25. Any discussion? No, with that, I will call for a vote. All in favor, respond aye.
Aye.
Opposed? Same sign, no opposed. With that, motion carries. Okay, so agenda item number 8 is our crisis ad hoc committee report.
Well, I
Sorry,
just have
Rita.
a question. So what's the next step now with this motion? It's approved and now it goes.
I believe the resolution has it going on down to the state. It's a
The state.
lobbying resolution, so it will go down to the legislature.
Is there anything we should do to encourage that down there?
You know, that's a good question.
You can call your legislators or
Absolutely.
to support resolution.
Yeah.
Always encourage that.
The resolution will go to county board for final approval and move to, go to the state.
State.
So it won't go to state until it goes to the.
Goes to the board.
But the best avenue for anyone to advocate is to make sure you're in contact with our legislators on these issues.
If you're wondering who your legislators are,
No,
we can
yeah.
get you that information.
Yeah, I got it.
Okay.
They do change around a little bit, so. All right.
Madam
so you-
Chair,
Yes.
I've been in touch with our Duke Turner from Barron
Duke
County,
Turner.
and he's our new rep. And
Duke Turner.
so he's the one that I've been working with on this, and he's gonna push that. But the more letters that he gets for support, the better. It's a matter that everybody knows the crisis of this, and we had enough money at once to build a facility, and the big crisis right now is appropriating enough money to operate a facility. So that's it'll be interesting, the new legislature, if they step up. We got to realize we got a Democratic governor, and it's you know, they've all got their priorities, unfortunately. So this is our big one. So good luck.
Thank you,
Thank
Johnny.
you.
Yes. I think we're ready to move into agenda item number 8, which is our crisis ad hoc committee report, and Tanya will give us that.
Okay, so Claire has, yep, we've got that pulled up. You can go right to the second page, Claire. This is the crisis ad hoc is a direct result of Chairman Luke's appointment of myself and a few other people, including Supervisor Olson, to a committee to study the crisis needs in Western Wisconsin. So Chairman Luke made that appointment. Was it May that we started that up? Earlier last summer anyways, the committee was formulated and we've been working since then on some solutions. The committee has taken various forums and had various subject matter experts at the table talking about what the needs are in Western Wisconsin. When we look at what are those needs, this slide talks about the significant gaps that have been historical in this area for inpatient crisis, mental health crisis services compared to other areas of the state. We have a nice map to show you on the next slide, but not yet. It's a surprise. So overall, there's 400 beds, about 400 beds statewide. Of that, 10 of those crisis inpatient locked facilities, 10 of those basically serve this Western region. So we are always clawing at those 10 beds. When those 10 beds are full, which is most of the time, we end up going to the next, we always go to the next one out. So Eau Claire, maybe a La Crosse now and then. But most of the time our people are headed to Winnebago. So they're getting hauled across the state. The reason why Winnebago is because it's a state-run facility and they are not allowed to have a wait list. So if we send somebody, they have to find a place in their facility for them. So with the HSHS closure, I believe we went down another 19 beds in the area, along with a substance use treatment facility in Chippewa Falls. So a really big gap. There is some talk for some solution through Gunderson of La Crosse, which is still going to be a 3-hour trek for us, or Mayo expanding their beds. Not very many, but there is talk of some expansion in the area. So then, like I said, Winnebago is usually our go-to. Sometimes if we can find one of those 10 beds, they end up transferring to Winnebago anyway because of the acuity level is too much for their facility. We will get, when we are working with Winnebago, they send out divert if possible notices to us because they're just at capacity. They don't have the staffing. They've got enough beds, but it's usually a staffing issue. So trying to divert to another area in the state. So this is a significant drain on our law enforcement resources as well as our human services resources. Next slide. So here's the map that kind of put it all into perspective for us. So if you look at, most of the services are concentrated the south east corner of the state. There's lots of beds down in that area. We are not crazy about having to drive people all the way through the state to meet that need that they're having on probably the worst day of their life. So this is just a good visual. I think it's had a lot of impact with the legislators and people who have seen it that, yep, we do have a big gap here. Even up in Ashland, there's a facility, not very many beds, but that's still another haul for us. Next slide. So we talked about some solutions, short-term solutions. I don't know if we have updated this committee along the way. I think we did with that interstate compact agreement. So much like we do in Department of Children and Families, if we're placing out of the state, we have to go through some hoops through the state level. There is actually statute that allows for that for the mental health commitments. And we came this close to having an actual contract with a facility in Minnesota. At the very end of, they received the contract, the templates and all of that, they declined our contract just because the needs in Minnesota are just as great. So they have to reserve those beds for their Minnesota residents. So we are a work group of directors in the Western region are pulling together another group to explore other options in Minnesota, as that would kind of meet our needs on this side of the state to see if we can get any other contracts. We've already got the template written, so if we'll divide and conquer and try to get something in the works for that. So along with the fact that we'll always need some level of locked facility for somebody, just based on acuity. The work group that I've been participating in wants to focus on more preventative measures. So if we don't have to use that facility in the first place, that'd be a great thing, knowing though that we still do need something. So we want to implement some proven methods to divert people altogether. Like I said, so co-responders, peer support services, recovery coaches, mental health officers, things like that to meet the person in the community and hopefully divert that need for having an emergency detention altogether. The Department of Services through Wisconsin also is in the process of rewriting Act 242, which would establish a prevention measure in behavior stabilization units. So they're not going to a locked unit necessarily. It would be a behavior stabilization and then like a step down into more community-based services. So that's in the works through DHS. We are always advocating for funding. I think that, they get tired of hearing of us from us when we're asking for money, because we're always asking for money. I think that our WICSA and Wisconsin County's administration, as well as Administrator Norby, we will be asking for more balancing of funding because the cost share is so far out of whack with most of the responsibility being placed on the counties and our local resources. And then some short-term funding proposed that the state allocates funding for the Western region. So just kind of like seed money until we figure out what the ultimate plan is to, maybe buy some positions for peer responders, recovery coaches, the things that I mentioned up above. So a note and to support why we think that some of these preventative measures would be helpful is that when we looked at data from Chippewa, St. Croix, and Polk counties, about 50 to 60% of our emergency detentions get dismissed. So that means they go over to Winnebago for the most part, and they have their 72 hours. They're back in court in one of our areas in 3 days, and those 60% of those are being dropped. So that tells me, and probably some of our behavioral health experts, that maybe we could have diverted that altogether because they were having a real bad day on day one. They've stabilized within those 3 days. They come back and there's not a need to have a civil commitment or settlement agreement or something like that. So I think that's good news for us and good. I think the legislators like to hear that when we met with them January 3rd. Okay, next slide. Long-term solutions is to develop sustainable service models. So it's a bigger picture thing rather than just building a facility. I think that's part of the equation, but there's other sustainable measures that need to be implemented and funded so that we have a sustainable service delivery model down the road. So we're always looking for grant opportunities. We've engaged regional planning, working with DHS. We've always got our eyes out for grant opportunities that will come along. We want to expand local facilities capacity for crisis beds, whatever that looks like, if it's a new facility or if it's existing facilities adding to their number of beds they have. But the thing that we heard throughout the whole, from May until now, is that sustainability is key. So if the state is going to throw one-time money at us, maybe a private organization or, to develop a behavior stabilization or crisis inpatient, they're set up to fail. So one-time monies help, but they don't help keep them open for very long because it's crisis and mental health services are expensive, and the current models don't support reimbursements that would keep them at least whole, not even making a profit, but you got to keep them whole so that they can keep their doors open.
Tanya, how many
Yep.
patients do we have out of county right now?
It depends. I think that's a moving target on any given day, right? Do you know how many we've had so far year to date, approximate? It's only January. Yeah. We can get that number for you.
We don't have anybody at Winnebago, do we?
Right now,
Right now?
I don't think so.
Okay. We'll get that number for you. It's only 13 days into the year, so there might be somebody down there. So we met with the legislators to do a wrap up as requested by, I believe, both Supervisor Olson as well as Senator Jesse James. I ran into him at the WITSA conference and he said, let's get something together before we go into session. So we got them together the day before they went into session on January 6th. So that's just a picture of the participation that we had. Joe and Joe were there, but they must have dodged out before they got their picture taken. I should have said not pictured because they're not in there. But this just speaks to the level of interest that we have from our local legislators. We had 6 legislators at the table for this meeting. So I think that's really big, along with Chief of Police from River Falls, the Chippewa County Sheriff. If you look in the background, you can see Don Burrows is on virtually, so he gets credit for coming virtually. Gay Magnifici was also virtual, as well as a gal from an advocacy group. So it was good. We had good discussions, and moving forward, some of the takeaways from that meeting was there was some shared interest in those prevention ideas. I think what the legislators were talking about, though, was having more of a standardized process across the state rather than typically what happens is the counties are on their own to figure out how to solve the issues. So they wanted more of a standardized approach across the state, so that something that would be more measurable and sustainable. There's always, like I said, there's always a need for an inpatient unit. We just want something a little bit closer to home. It's good for the person. It's good for all the resources involved. There was a shared concern over the sustainability. So there's a lot of talk on, what is the Medicaid reimbursement? What does it need to be? That would play into private sector and their payer mix. So we'll work with the legislators on drilling that down. And then the question that I had was what exactly is fully funding of the community support program and crisis services? Because when they talk about fully funding, there's a lot of pieces and parts to what that means. So, hey, if they want to fully fund it, we welcome that 100%, but it really is about case management services, beds that we're buying, keeping people safe, community placements. So there's a lot in that. CSP and crisis services are a big part of our budget and county community services. Did you have something?
Yeah,
So-
Co-Counsel also has some numbers.
We had 2 cases so far this year. Both were transported to Winnebago. Neither of them were Polk County residents, but Polk County still has the cost of the initial emergency situation. And so Polk County covers that initial cost, and then it gets transferred to the other county after we do probable cause. It also takes up the local law enforcement's time, regardless of whether they're our resident or not, because we still have to get.
So if the crisis happens here, we're on the hook for the first 3 days to get them to a facility, as well as pay for that facility. And then our staff in community resources in the crisis unit work like the Dickens to figure out what is their home county and getting them transferred to the home county. If it's out of state, we work out of state to get them back to their county so they can get the services they need.
Joe, do we know where they dismissed when they came back?
So Milwaukee County refused to, or chose not to prosecute on one. Prosecute's a bad word, but it's the word that I have available. And Forest County asked us to extend a settlement agreement, which means they need to comply with the doctor's orders and everything that's requested of them for 90 days. And then after the 90 days, the case will get dismissed if they comply. If they don't comply, then Forest County will file a notice of non-compliance with the court, and then the process starts. Yeah.
Okay.
All right. Any other questions?
I just got a couple, and maybe these are dumb questions, but I'm gonna ask them anyways. So 50 to 60% of emergency detentions are dismissed. You got from these 3 counties. Is that a standard number though across all counties? Kind of in general, they get held for 3 days and then they're just dismissed. I mean, is it just Northwestern Wisconsin that has those kind of stats? I mean, I know I'm not expecting you to absolutely, but I mean, just in general, is that kind of our trend? Do you think it's kind of
Run that through our lobbying group to see if they wanted to put that out there to see what, I think it depends on the court and the prosecution and, what that individual county's
okay?
practices.
And then, so then what happens to them? I mean, just, that's it?
So they're,
We utilize all these, they've had this major issue, and I'm not trying to put money on it, but we've utilized all these resources to come back and say, you're good? I mean, is that what happens
I
to them?
think we work to get them hooked into some services.
Yeah.
So
we
for
would work with-
voluntary.
Right, linkage and follow-up, give them resources, but it's voluntary. So they can choose to or not to do that, which is where you'll see that cycle.
Right.
Sometimes with folks.
So then we do have a certain amount of repeaters.
Well, and so we did receive a question about recidivism from one of the legislators in the committee. And what I said is, I don't see a ton of recidivism. Normally 1, maybe 2 a year, where we will have dismissed earlier, and then we end up seeing that person again either that year or the following year. It's pretty low, and I think it's because a lot of these are very acute situations where someone is in crisis right now and they get the help that they need right then, but then are also provided direction on where to go to seek help if they start feeling the same way. Or a lot of people may have stopped taking their medications, and this is a sign, okay, well, maybe you need to keep taking your medications, and they are compliant. It's again, rare. One out of, I think we average about 40, 45 cases a year. One out of those a year we see again. And if we see them again, then we're in a situation where we say, okay, well, we've been here before. Now we're probably going to follow through with the commitment. Now, a commitment's only 6 months. A settlement agreement is 90 days. So 90 days is half of that full commitment. If at the end of that 6 months, they need to be recommitted, it's only for another 6 months. So when you're looking at the treatment, we really rely on what the doctors are recommending. And oftentimes, most times, people are returned to a level where they can take care of themselves and make sure that they get to appointments and do everything they need to. They're availing themselves of the services that we provide within those 6 months. Rarely do we have recommit as well. So again, the reason most are dismissed is because it is a very one-time situation, and they are provided the help, and then they then avail themselves of the services that they need, because now, you know, they may have, this may be the very first time they've ever had an episode like this. We see a lot of 20-some-year-olds that are just finding out that they have schizophrenia or a bipolar disorder or those types of things. So it can sound not good that 50 to 60% are getting dismissed, but they are getting the treatment that they need, and generally there are positive outcomes.
Yeah, so if we can stabilize them here rather than sending them to a locked facility, that would be a good thing.
And the way the statutes are currently written, it requires us to get them to one of these beds. That's the problem with how it's currently written. Now, how, I'm not smart enough to come up with an idea of how to mitigate that on the front end, but that's kind of what we're asking the legislature to do.
And one of the things that we really try hard to do, our crisis team, is when we have somebody who maybe has recurring crisis contact, or an ED has been dropped, we really work hard to get them in with psychiatry or in with a therapist, get them back on their meds. Those are priorities for us. So we'll work our schedules as we can to get them into the doctor's schedule to get them back on their meds. Those are priority patients.
And when you say some actually go to a 6-month commitment, so is that in a in-house treatment facility?
Not necessarily.
So that's not necessarily what does technically a commitment mean then?
It means that the department basically monitors what they're doing. We have the authority then to, if they drop out of compliance, we have the ability to file something with the court basically saying we're moving them to a higher level of care. So they might be in the community and we might move them to a community home. I don't know the names of the facilities.
Yeah, CBRF or adult family home, or they just might be in the community.
Sure. I mean, because to me, when I hear the word they've been committed for 6 months, I instantly think they are going to a facility.
No,
You know.
they have specific guidelines, like they have to follow up with their meds. They have to go to their therapy appointments or see their psychiatrist. And that's what our case managers will do, is they'll work to make sure that those folks are connected to those
Got it.
identified needs.
So
Well, and it
And
also
anytime
is
they-
identifying barriers to getting, so if it's transportation, we're referring to ADRC or finding a different ride. So trying to help them to remove those barriers so they can.
Do they need food share? Do they need, to get on Medicaid and all of those things? It's that linking that happens.
So when you're under a commitment, it just means that the county is continuing to supervise your treatment.
Thank you.
It's good.
Lisa, how much do you rely on family members for a wraparound program once they're dismissed or once they come back?
That's one of the things that we really work hard to, is to find those informal supports. So it may be family, it may be friends. The problem is oftentimes those folks have probably burned their bridges with those folks. So they may not have those informal supports, but that's our first go-to. Identify those informal supports, get them involved in that treatment process to make sure that, when they're done with their commitment or their settlement agreement, they still have those services kind of wrapped around them with their informal supports.
Okay.
Do you have any other questions for Tanya, comments?
A little bit more here. So the agreements, I think unanimously, was that this is a nonpartisan issue that we need to resolve. So, there's a Republican majority right now, but none of them seem to mind that. We also had 2 of our representatives, is it 2 or 3, are on joint finance. So that's, double score for us that we'll have the joint finance committee's ear when we're making these asks. Also the shared concern over the resources for crisis of all ages. In addition, the lack of services for those high acuity youth that we've talked about coming from Lee's unit and those high cost placements, out of state placements that we've been having. So they're very well aware of both of those issues that really put a strain on everybody involved. There's talk about a smart form for medical clearance because we hear from law enforcement partners that can be a huge drain while the deputy or the officer is having to sit at a hospital and wait for medical clearance up to 8 hours to get them transported over. So it just adds to that. There's a smart form that I think River Falls has been using it. They want to make that more of a universally accepted practice so that the EMTs or the clearance can happen a lot quicker than what it currently does. Did you have a question, Rita? Okay, you're just doing that. Okay. So counties, they want us counties coming and talking whenever we can down to Madison. So we always go down to Human Services Day at the Capitol. There's a CAP meeting that I've participated in coming up January 23rd. So I'm planning to go to that if I can get out of jury duty. But otherwise, just getting down there and connecting with our legislators whenever possible. We also agreed that we'll reconvene our legislative meetings. Supervisor Bonaprise has been very influential in attending those. We'll get those pulled back together. I think it started out more in the public health arena, but we see benefit for all of human service type work to be able to meet with our legislators and talk about the issues that we're experiencing. So we'll get that back in the works. We need more data from the counties to be able to drill down and create those solutions. So working with the legislators on what they need from us for cost, number of placements, what does all that look like so that they have a good understanding of what they'll be advocating for walking into developing bills or whatever. And then just us continuing to seek grant funding. I think that's the story of our lives. We're always looking for funding opportunities and working with the state of Wisconsin Department of Health Services on getting this stuff rolling. That's probably it. Any other questions for me?
Just have one. This is really off the wall, but it just kind of popped in my head as far as, some of these people you talk about, part of the problem is either they're not on the right medications or they've gone off their medications or whatever. You constantly see ads about pharmaceutical companies saying, hey, you can get your meds for free, whatever. Is there grants available through the pharmaceutical companies ever?
I think they'll have starter packs or.
But actually to help the bigger problem, not just to help support their product, but it's just, like I said, it's like they're out there and looking for, because grant money, I know, or money is always hard to come by. I'm just curious, is there ever anything out there in the bigger pharmaceutical companies on private grants to work on these?
I think it's more about finding them either a commercial or a publicly funded insurance plan to help them pay for that.
Mm-hmm.
Some of the companies, if it's like a super expensive med, they might offer a discount for the name brand, or you try to
right.
whatever. But it's really about us connecting people to what are the, if they're a marketplace plan or a Medicaid or,
right.
and they have
commercial
commercial
alternate
insurance
sources of potential funding. Is that something that's even out there, something that most people wouldn't think of? I just like I said, random popped in my
Thinking
head.
outside of the box. Nothing wrong with that.
There you go.
Definitely. Supervisor Olson.
So, yeah, I think it was a good meeting we had with them. It was exciting to see 6 legislators, at the meeting. And and they talk about stop in the office when you're there, but you know, how many of us are in Madison very often?
I think you're down there all the time.
Well, yeah, with the exception of me perhaps right now. But I think making that phone call is as important as being in their office. And, you know, and not worrying about that you're not talking to the assembly person or the state senator, the staff. Just getting your voice heard is as important as walking through their door.
I think the message was they want to hear from us. However we make that happen.
Yes, and to go off of what Brad said, it was very impressive to have the legislators in-house talking and discussing among themselves. They weren't just sitting there actually listening to what we had to say, which they did listen, but they had great interaction with each other on ideas and networking that way. So it was very positive, and my hat's off to Tanya and her group and the committee for all the work they've done on this, because we definitely have some traction on this issue. And moving forward, again, contact your legislator and make that phone call. It'll go a long ways.
I did just hear,
Possibly, you can provide us with the names of our legislators and their phone numbers or contact information.
absolutely. I did just hear from one of the legislators' office late last week that the new hospital replacing the St. Joseph's and Sacred Heart in the Chippewa region, they are looking at trying to contract some mental health services. I don't know what that looks like, but they do acknowledge that the mental health is a piece of that care package that needs to be addressed in this area. So they will be reopening St. Joseph's in Chippewa as a Band-Aid to get them until their new facility is built. Not sure what the mental health services would look like though.
Okay,
All right.
well, with that, thank you
Mhm.
to everybody who took the time and served on the committee and attended the meetings, advocated for us, went down to Madison. Thank you very much for all of your hard work on that. It looks like we've got to start to head in the right direction on things. So I appreciate everybody's action and work on that. If we don't have any other questions or discussion, we'll move on to agenda item number 9, which is the ADRC Central Kitchen update and possible action. Mo, or Laura?
I'll start out on that. Laura, if you want to come up in there, as you recall, during the budget process, we set aside $50,000 to look at placing a commercial kitchen in the Endeavors building to assist with the Meals on Wheels program. We reached out to an engineer to get an engineering estimate on what that would cost to put in a commercial kitchen over there. That estimate came in at around $900,000. So it's very expensive on there. So I met with Laura last week to look at what's our next steps and how do we bring that number down and what are our options on there. So very good discussion and
No, it was all good, all good. So, yeah, that number came in a little bit higher than we were anticipating. But we had, for that background information, the meal site was located in the Milltown Community Center that had burned down last fall. And so we are set up currently in a church in Centuria, which is working out great temporarily, but it is not going to be a long-term solution. So back in October, I think it was, we did take a tour of Endeavors, and Sabrina's here and she runs the programs. And so she actually knows what's needed in the sites, not me, and the equipment and how it needs to be structured. And we are in agreement that that location is a great option. It's centrally located within the county for the meal distribution going out into the homes. And then also having the Endeavors folks there, we're able to maybe tap into some of their skills for packaging, give them a little extra work. We could do the meals for them, save a little cost on their end. So it would be a real good partnership. And so of all the options we have seen so far, that is the one we would like to pursue. So unfortunately, that sticker was a little shocking for that. So what we're going to do right now is look at different options for funding, of course. After hearing a couple other stories of looking for funding, we're going to get right in line. So looking at just going through this recently in Burnett County and seeking out funds, we have discovered that grants are not a very good option for this because we are talking about buildings. Grants tend to be a little more for the programming itself. We do have the funding to maintain programming once we have the facility. The trouble is getting the funding to actually get that facility up and going. So looking at what we have just gone through last year in Burnett, it was a lot of fundraising, reaching out to potential donors, foundations. What we were successful at up there is getting the community together and viewing it as a community project rather than a governmental project. So we were successful in getting a lot of local vendors and builders to donate some of their time, donated the plan development. We have lower costs and overhead on the building projects because we were able to do the bidding process and we were able to secure a local vendor to do the building. So what our idea is at this point is to see what we can do in Polk, something similar, reach out to those local builders, see what we can do, local vendors for potentially the appliances and work that way. Nicole here had done a lot of the work for securing the donations. Nicole, do you want to just share a little bit about your process and what you ended up with donations?
So in Burnett County, I mean, initially starting was lots of research to try to find these nonprofit organizations, groups, local donors. And then, just initially reaching out to start to build a relationship. As Laura was saying, it really involves the entire community. So that's, kind of the approach we took. So we applied for many grants and were unsuccessful with larger state grants because it is a capital, expense is what they were terming it. So we did end up with just shy of, it was around $47,000 in donations for, from the local nonprofit groups and things. So, and some of which serve both Polk and Burnett, similar to us. Some are very connected to Burnett County itself. And so we would need to, start that research over again to really determine who's out there for maybe more connected to Polk County. And then some of the groups that we have maintained relationships with, just having them donate and keeping them in touch with the whole process and what's happening, may still be willing to donate to the Polk County site as well. So that's where we would need to just really take a look at who we currently have that good relationship with, and who would potentially be willing to donate again for the different site, and then taking a look at maybe getting some more new relationships built with other partners and donors out there.
Thank you. I did, in meeting with Mo the other day, he did give me a contact at the Regional Planning Commission. I did reach out to her, spoke to her. She talking about, see if there are any specific grants out there that we're just not aware of. And she said off top of her head, she couldn't think of any, but she will be reaching out to her counterparts. She understands, we had a good conversation. She understands what we're up against. And I kind of like, well, it was a actual fire that took it out, not just we're trying to get money to do something. So let's tug on some heartstrings or see what we can do, using that angle. So, so as an update, that's, I guess, where we're at. The 47,000 may not seem like a lot when you're looking at this big sticker number here, but that's also looking at the comparison of Burnett County and the funding up there compared to Polk County. And I don't mean governmental funding, I mean the community funding available. So, so we will start, like I said, we just got this number last week, at the end of last week, so we haven't jumped in too deeply, but we will get going on it and see what we can do.
And this was kind of bring the committee up to date, just to give you info on what we're doing and how we're pursuing to that, because that number is very high. So we're looking at all our options on there. Jokingly to Laura, I said it might be cheaper for us just to buy a restaurant. Really, I mean, it's an option.
Well, and
I didn't mention a food truck tour, but but we're looking at every option because $900,000 is just out of the realm to try to do that right now. So we really need to look deeper into what's available with West Coast Regional Planning, because I know they have different programs for businesses and everything to come up on board and stuff and what's there. So
in the restaurant comment is not actually a crazy idea. So when we were doing the process up in Burnett too, and again, I'm referring there and not here because we just got these numbers, so I haven't done it here yet. But we did look at the different buildings that were available. And we went and toured one restaurant up in Webster, and then also looking at some of the other commercial buildings, what it would cost to upgrade and get a kitchen in. So, the issue though is also looking at that centralized location, which for this purpose is essential too. So it would need to make sense and not just be a cheaper version option.
Oh, go ahead. Oh,
Go ahead.
Rita?
I'm wondering if you could remind me, where did this $900,000 come from? I mean, who came up with that?
it's an engineering estimate of what the project would cost.
So engineering, just a private engineering consulting group or something, or?
Right, we asked an engineer that we work with on other projects, if they could give us an estimate of what a project would cost and what it needed. Got information from Laura's group on layout and what was needed for the facility.
Yeah.
Put it all together with permit fees, engineering fees, along with the reconstruction of the building and everything. And
because I was really intrigued with what you said about using for appliances, using local builders, using, getting some grassroots more, involvement, because it seems like you can save money on some of these. I mean, that kind of
and we had that discussion too. And so I told Moore, asked him, how do you feel about me reaching out to local ones, get comparisons to what we were given? And he was all on board with that.
right, and then we do have that public procurement. There are a process that we have to follow when we talk about public projects and public works projects, and the statutes that we have to go out for public bidding if it's over 25,000. So there are things we have to do as a government that we just can't sometimes make it easy to have volunteer work come in.
But we can get a sense though in discussion with them how comparable we'd be talking with expenses and stuff like that. Oh, another thing I forgot to mention is we do have, the aging program does have a fund balance. We were looking at that when we were contemplating the old jail and fixing that up years ago. And there we have about $350,000 this was a few years ago, $350,000 in a balance there. So not saying to take that down to nothing, because we would not want to do that. However, that may be another funding source that we could tap into to at least, if we're looking at, we almost got it, but we, could use a little more. We may be able to tap into that.
And what was the cost of the Burnett County project?
Well, I brought that here anticipating. So keeping in mind that there we are building building from scratch. We got the land donated from the Village of Webster, and using the local builders with lower costs estimated. With the appliances put in, we're looking at $535,000.
Thank you.
But also it ended up going up. There were some unforeseen circumstances. So it won't end up like that. It'll be a little higher than that, but yeah.
So I guess just some thoughts that I have is the engineering firm estimate. That like the county engineer, do we have to exclusively use that engineer?
No, it was to get us in the ballpark of what we needed.
And what about a builder as well? What if a,
Go out to a builder until we had plans.
Yeah.
until there were plans and that work had been
Right.
done?
Have reached out to one builder on a general estimate, but haven't got that back yet.
Okay. Then another question I had is I recall when we had our audit presentation, and Jonathan Sherwood was here from Clifton Larson Allen. I specifically asked Jonathan about the fund balance in the ADRC, and I believe he said it was around $900,000. When I asked him specifically if that money could be used or allocated, he said that certainly, yes, a portion of it could.
Oh.
So I don't know if that's something maybe just to follow up on and maybe get more information about. And that was specifically for the ADRC and not specifically for just this program, but it was for the ADRC as a whole.
Yeah, mine just because that is a significant different number. Mine was 2020 and that was specific for aging. So maybe ADRC put in with it or something. I don't know.
Yeah, and I don't know if COVID had an impact on, some of those things or not, but if we could just maybe follow up and just for me, I guess I would just like to see maybe just some clarification so we know for sure where we're at and what we can do and what we can't do. Supervisor Olson?
So the $47,000 in donations, was that from nonprofits only, or was there for-profit donations in the 47,000?
That was community and nonprofits, and there were some faith groups in there as well. That was all local. Yeah, there was no for-profit, but community members themselves, had also donated. So yeah, all nonprofits and all local.
Another item we looked at there, which was looking at some of the, like there's a school that had, I think Webster School that has a woodworking team or something like that to use students, which we might be able to in the finishing stages or something. So we're really trying to, I don't know, sell it, but make it into a community project. So.
Just one quick question. You mentioned you have certain parameters because it's a county project. Would woodworkers work? Would a community, a Habitat for Humanity woodworkers from the school? I mean, is that allowable?
Depends on the parameters. I'd have to know the specifics before I could ask the lawyer the question,
Yeah.
just to make sure we're not doing anything.
Right. Yeah, I'm sure there'd be some liability involved there. Yeah. And that's why I say maybe at the kind of the finishing stage. So for the building itself in the Burnett situation, we wouldn't happen to them.
Not like the old barn raising.
Nope. That would be nice, wouldn't it?
So just in conclusion then, well, Brad's got a question. Go ahead, Brad.
So would Polk County need a bigger facility than Burnett County? As far as a building, I mean, if we're looking at $900,000 to retrofits, let's say $600,000 like Burnett County is going to spend to build something brand new. I don't know, it seems kind of like a no-brainer to me. But is that facility big enough for Polk County if we were to build one here?
What's the comparables with the numbers?
The building that we would need in Polk County would need to be a little bit bigger than the building that we're building in Burnett County. And I mean, ideally, if we wanted, what we did in Burnett County was a commercial kitchen with a small dining space so that we can host congregate meals in that location. We could use a building that size with creating the kitchen a little bit bigger and a less sized dining room and just make it a distribution center for the same size, but it would just be a different, you know, it still would be a little bit, the kitchen would be a little bit larger, so then the cost would be a little bit larger.
So at one point, it had also been mentioned, possibly looking at, you know, contracting also with the same business that does the meals for the jail, but that has nutritionally wise and cost wise, that is not a good option.
Right.
Or you expound on that a little bit?
Right, and we actually had been in that contract with them several years ago now, and it was not successful. The nutritional requirements for the different groups are different, and the quality ended up really dropping. I think it was significantly it was not a good fit, and the community did not like that.
Okay. And then two, it had been mentioned at one point, something about if there would or would not be any possibility of utilizing a portion of the old jail building or a remodel somewhat of that is, yeah.
We're pretty much in the same boat.
Okay.
With one big caveat is the logistics of the parking lot and everything right there.
Okay. So it's the Endeavors building then is my.
That is the best location.
Okay. Just to kind of review different things that were touched upon at one time.
And the added benefits of using that building with the existing programming that's in there is a good fit.
So Mo and Laura, do you have a recommendation for us on how to proceed with this? Do we want to do like a full-blown study or what do you think?
I think at this point, since we just got this information right now, for information purposes, we're going to explore these other options to see where we're looking at, get you some more information.
Okay, so we don't require any action today?
Not at this point. I put it on the agenda just in case.
Sure.
But that way, but it's more informational discussion at this point.
Okay. Well, thank you for all of your time and energy and putting into this. I know it's it's a complex issue. So thank you for that. Okay, so moving on then, agenda item number 10 is our alcohol compliance report.
Okay, so this is something that public health does every year. Actually, we took a little dip during COVID for obvious reasons. So we're ramping those back up. They did their alcohol compliance checks earlier this fall. So they want to talk about the findings of those compliance checks. It's alcohol and tobacco. We'll start out with tobacco, as I see Felicia standing up there. She's the tobacco guru. And then we'll carry on with Caroline and Lisa.
I'll make mine short and sweet. Mine's a little simpler. So I'm Felicia. I'm a health educator with the health department, and I work on our tobacco prevention grant, which also covers our tobacco compliance checks to ensure that our retailers are not selling to our youth under the age of 18. So this year in June 2024, we completed 46 tobacco compliance checks with 2 youth members of our community. And We just check that retailers are not selling. And then when our youth go in to conduct these, they use their real Wisconsin ID stating that they are under the age of 18. Our goal of these checks is not to trick our retailers, but just really see like if they're following the state statute or not. We do this in partnership with our Wisconsin Wins program every year. In 2023, 2024, as I stated, we completed 46 checks. Oh, sorry. Try that number. 9% of our retailers sold to our youth, which is a 4% decrease from 2022 to 2023. So we had 13% of retailers do that. And then you can see that these are the areas that actually sold to our youth. All of the sales that sold never checked our youth ID at all. Next slide.
What did they buy?
So we do a variety of e-for products that are more common amongst our young adults. So we had a variety of disposable flavored e-cigarettes, Zyn pouches, and then we did have 1 pack of regular cigarettes. So you can see all of our areas that did not sell are right here. And then in follow-up to these checks, we always send a letter to the retailers, whether they pass or failed or not. Those that failed receive additional education through our Wisconsin Wins program on their ID training that they have that is free to retailers. And then we also provide education on the tobacco sales age law. So Wisconsin's law is different than the federal law, which is 21. But since Wisconsin's 18, we can only check for the age of 18. We also provide education to our local municipality law enforcement. We provide the names of the retailers that did sell to youth because it's then on their end to decide if they're going to fine them or not. Next slide. So we do this. The reason that we do tobacco compliance checks is obviously to limit access to our youth. We just wanted to provide some background data on our 2021 YRBS. We're using 21 because we didn't have data from our county for 2023 because not enough of our schools completed the YRBS. So as you can see, this is our rate for high school right here. And then local youth vaping use, 6% of Polk County middle school students have currently vaped in 2021. And then 33% of high school students reported ever trying a vape.
Just curious, why are your like measurements different? And the fact that you got 6% are currently.
This is the YRBS data, and then so like Polk County in Wisconsin, this is Polk County specific.
Right, I understand that, but my question is why though on the 33% you've got ever tried versus currently vaping? You know what I'm saying? I mean, if we want to look at apples to apples, you've got currently versus ever tried.
Right.
I mean, ever tried is a pretty big number.
One's middle school, one's high school.
Right, but your basis
and then
issue though is totally.
This shows current vaping in high school.
Okay.
For the same YRBS, but this shows it across all grade levels in high school.
Okay.
For Polk County compared to Wisconsin.
So we're saying 12th grade in Polk County, 33 or 34% or 35, if I'm looking at that graph, are currently vaping.
Yep, and then it's showing it in comparison to Wisconsin. So you can see
Yep,
that.
yep, I'm following that. I'm just looking at.
Yeah, so I already had it there, so then I just.
Right, but you see how the verbiage is different though, why it's, because a lot of people try, but doesn't mean they keep going. So that's why I think that try number is very kind of misleading or confusing.
So are the 6% embedded in that 33?
Yeah.
No, one's middle school, one's high school.
Do they
No,
take
but
the
you're
same?
saying, because now.
They're.
I guess I'm on with
We're
you
getting
now.
at, I just.
You're saying the 33% have ever tried, so
Yeah.
yes, but you're not saying that's current. Where the 6%, you're saying they're currently vaping. Are they included in the 33%?
One's middle school, one's high school. They're two separate surveys, like middle school gets a separate survey, and high school gets a separate survey.
Maybe you could speak to what is the
Right.
YRBS and how is that?
Ever tried should have been removed and currently should have been put in there.
Right.
That's how the questions are worded on this survey that's administered to our middle school and high school students. A lot of our middle schools choose to not partake in a lot of this survey because they, there's a lot of questions that are topics that they might not want to get into with their students. And so we are really underrepresented in our middle school data. So that's why we have more high school data that we're focusing on, but the wording up there is the wording used on the questions when they're asking the students about their use.
Right, but the term ever tried is such a broad, I mean, so like asking any high schooler, have you ever tried drinking? Probably you'll get 90%, but are they drinkers? Might be 10%.
You know, I'd like to see
So-
the question be, if you've ever tried, are you currently using?
Right, if we're
In that-
gonna get the idea, I mean, how many of them have been to a party and like, you want to try this? Sure, they've tried it versus are they really using? Are they purchasing? But yeah, the questions I think could be changed.
And that's
And
why
I
we
think-
have it side by side with the currently using, because that shows the breakdown between grades versus as a whole looking at high school. Here's what we have ever tried, but breaking it down, currently using. I mean, and again, that's just how the survey is laid out, and that is, this is the most in-depth data we have because a lot of our schools do not allow us to go in and survey students.
Sure.
So unfortunately, this is what we're left with.
Do they ask the
But even
same
the bar
question?
is not,
Yes.
that
That's
doesn't
the
make
same
sense.
question in middle school and high school?
Some of the questions are not asked in the middle school versus high school.
They
I
have.
think that's where they're trying to compare middle school. and high school.
33% of high school students have tried when currently using, you've got 35%, almost 12th graders and down.
Yeah, go ahead.
So eliminating the 6%, just don't even look at that for right now, okay? Because that's middle school and the other two
Yeah.
graphs are high school. The bar chart shows the yellow color being Polk County.
Mhm.
33% of 12th graders are currently using, but
Or high school.
11th graders, only 25% of Polk County 11th graders are currently using. Less than 20% of 10th and 9th. Now, 33% of high school students across all four grades, 33% of all of those students
Saying they've ever
have
tried.
tried.
Okay.
So the
I'm
two
following.
numbers aren't
The same.
conflicting with each other. They're giving you different information.
Right, and I understood that from the start. I'm just, if you were trying to set these up as a comparison, they were saying two different things. And that's why I'm like, that's why I wasn't following. I understood what it was saying. I just thought, why would you have this saying this and this saying that? And I understand the junior high versus high school, but I get it. Now I'm following, I'm picking up what you.
Yeah, the only comparison on here is the Wisconsin versus Polk County. The rest is just for additional information. Guys, no.
Got it. Yeah, sorry, Felicia.
No,
I
that's
just,
all right.
just like,
Go ahead.
Okay, being the old high school person, let's go probability and statistics. So first of all, how many schools were surveyed in Polk County?
That's a very good question.
This is 2021.
Okay, but how many schools?
Two of our schools in 2021 did not complete it. So
Okay, so six did.
Yep.
6 high schools and I think maybe a few less middle schools participated. in
Okay, we'll leave the middle schools out. Let's just take the high schools. So not muddling this up anymore. So out of those 6 schools, how many students were surveyed?
that would require me to know the number of students in each school.
That's correct, but that's easy to find. So my question there is, without muddling any of this more, what happens is if you do 100 kids, if you survey 100 kids, you're telling me that 1/3 of those kids have tried vaping. Does that make sense?
Yeah.
Okay, so now we just expand that out. Again, I'm gonna go with the ever tried. I've seen a lot of those surveys. Kids will write anything down. What's the probability of error margin? 1 to 5%? Okay, so I guess, I'm not being a smart aleck, but I would have just left that slide out. I would have saved a lot of issues. Because you need to know how many kids have been surveyed. I don't need to know the percentage. I want to know how many kids, how many schools, and then I need to know the grade levels. Is it 6th, 7th, and 8th? Only 7th and 8th. Is it 9, 12, or is it 8, 12? Because every school district is different. So, and I know that gets a lot of discussion, but just seeing a lot of statistics from high schools, I know how that works.
So if we want specific data for each school, we have to go to the schools personally and ask if they're willing to share that data with us. This is from a county-wide report that only gets released if there's statistically significant response rates. And so just for other background, like they do only release this data to us in this format if it is statistically significant based on the numbers who took the survey.
Because our schools don't all share with us directly. So we don't have each school's broken down report.
No, 33% is not a huge number. You stop and think about it.
Yeah.
But again, in comparison, you have to know how many kids are surveyed in order to get your 33%.
If you want that data, we can send that to you after.
No, I don't need to see that. And I'm not being a wise guy about it, but I've seen enough of the data, so I know how that
It's
works.
not meaningful.
And it's not very meaningful until you get some other statistics to add on to it. It will make it so confusing for all of us here.
If it was 3 kids and one does it, that's 33%.
Right. I mean, if you just surveyed 100 kids, that means 33 out of 100 did that.
Yep. All right, I have one more slide.
Okay.
I'm just gonna
Moving on.
move on. So our next steps after these, we continue to do these compliance checks every year. We take the data that we got from them, report it to the state as well, so they can kind of flag the retailers that are constantly selling to youth. And then they'll go through a FDA check that is completely separate than us. We provide information of our compliance checks findings to our community and at community events, schools if requested. And that. We tailor education on youth access to keep limiting that in other ways. And yeah.
Just like, get me out.
Hello. All right, I'm Jason with the Health Department. I am a public health educator and I help to run the alcohol compliance checks. I have the slides here too as well, but thank you. All right, so again, similar goal, checking the retailers to those who sell alcohol to make sure that they're complying with the age law of 21 to see where we're at with youth access to alcohol. So this year we completed 47 checks. This was actually the first year that we also checked on sale establishments, so bars and taverns. So that was a new part of our process. I think last year we did 39 total checks. For each check, we had an 18-year-old volunteer who attempted to purchase alcohol, again, with a real legitimate vertical facing ID that says they're under 21 until such and such date. The buyer or the volunteer isn't supposed to dress older or anything like that to alter their appearance to try to trick the sellers. And we worked with the municipal police departments this year. So we followed up with them for sales. And all retailers were mailed a prior notification that the checks would be happening in the near future. Next slide. All right. So here's what we found. So we broke it down into retailers, which is going to be your liquor stores, your grocery stores, and your like convenience stores. We had 5 retailers who sold and 23 who denied the sale. And then for bars and taverns, we had 9 sales and 10 no sales. So that one was a closer split. And then we also broke it down by taverns and retailers by police jurisdiction on the right-hand side. So you can see each of those jurisdictions there. Any questions on that slide before I move on? Yes.
I have a question. So, for example, the first line, Amory, 2 out of 2 taverns. That means out of the 2 taverns that were checked, both taverns sold to underage kids.
Correct.
And then out of the 6 retailers checked, none of the retailers did.
Right. Yep. That is correct. Yes. All right. Any other questions before we move on? All right. So next slide, we have a little bit more data. So we also broke it down by whether or not for those that did sell, whether or not they checked the ID. So 35%, 35.7% did not check the ID when they sold to our underage buyer. And 64.3% checked the ID and still sold to our underage buyer.
Crazy.
And then we can see the breakdown by taverns and retailers again. So for the retailers or the off-sale establishments, 4 out of 5
did check the ID, and still sold. And they were a little less likely to have their ID checked in taverns, with 5 out of 9 of the sales, not checking, or sorry, checking the ID. So 4 out of 9 did not check the ID. And then we did these over a period of 3 days. And you do see a little time jump here, and there's a bit of a reason for that. And the reason we wanted to put this date up is this year what we did is we worked with local law enforcement, local police jurisdictions. And when we had sales, we notified them of the sales, and they were following up right away. That way it was easier for them to make contact with the actual seller, the person who sold, as opposed to us giving them that information later. So the first day we had 7 sales and then 5 no sales. So 5 times that they were denied. And then the second day, which was 4 days later, again, these are different jurisdictions, so it's hard to compare directly. But we ended up with 4 sales and then 11 no sales. And it is important to note that our underage buyer was getting asked if they were part of the sting. So word had gotten out that we were doing this, and I did hear from some people here that there was discussion of this at some of the local taverns, that this was happening. So it had word had spread. So then we tried to wait a little while to let things settle down. And we did run into the same issue with our buyer a couple times, being asked if they were part of the sting. But so we waited about 2 months and then went again, and actually sellers were very successful. Only 3 sales and then 17 no sales on that last date.
So what would have been the correct answer to that question?
Yeah.
What, you know?
Yeah.
The kids did
They
they?
just want to buy, you know.
Yeah, so we don't allow them to lie about their age, but we didn't have them admit to being part of a sting.
But I think it's important to note too, that we use the same male volunteer for the first 2 days, and then the 3rd day we used a female volunteer too.
Yeah.
So yeah, so it was different buyers.
They were all sent a letter prior to any of this
That was
occurring.
gonna be
that
happening.
We wouldn't be doing those checks, so maybe you could let some.
Yeah.
Yeah, so I guess it seems like kind of like, you know, if you're sending me a letter saying, hey, we're gonna come and check you, that's kind of like saying there's a flashing light saying cops ahead, slow down. I don't think we should be surprised that they were wondering if an underage buyer. It's like, I told you, and I don't know, it seems like if I'm telling somebody I'm coming to check on you,
Should be on your best behavior.
well, yeah, I mean, hopefully I'm gonna watch it for a while. And at the end of the day.
Yeah.
$376 in fines in Amory, and the Frederick and Luck Police, you know, find the sellers. Does it really matter? And I guess my other question is, and maybe it's coming yet, but these were all municipalities. What about my bar in the countryside? I mean, we're not sending them a letter at all. We're not checking them at all. I mean, because that's, if you want to sell to underage, and it'd be pretty easy to know, I think. Go outside of one of these villages and they're not even going to get checked, and you're not going to.
So
sellers. So I mean, I guess my question is, why didn't we go to the countryside at all?
So I'll pass that on. One thing really quickly, letters did go out to all alcohol license holders. So they were all told that these checks would be happening and to be prepared for them. But I'll actually let Mo.
Yeah, as they work with they reach out to each of the municipalities and the sheriff's department on participating in the program. For this round, the sheriff's, our local sheriff's department did not participate in the program.
Okay.
So you did look ahead at the next slide. Any other questions on that previous slide? Yes.
If they have more than 2 or 3 violations, is there, you know, they get these citations and it's $300, whatever. But if they get a certain number of violations, do they lose their liquor license?
So that would be, we communicate that with the municipalities, which are the license issuers. And we don't necessarily have a say in that. And unfortunately, it seems that most of the repercussion falls to the individual seller, the employee who sold, as opposed to the business.
And so I'm not asking if you enforce, just do you know, is there a,
Right.
so, I have 20 citations, okay, well.
Right. Hopefully so I don't know of anything that happened with their license. Hopefully if this becomes an issue, it would raise awareness for that local police department to monitor that business more closely.
Yeah.
Hopefully, which would hopefully elicit change.
So just a comment is that the local municipalities oftentimes by ordinances will have kind of a process in place. Some of them have like a point system for violations. And with so many violations and so many points, then that would go towards a municipality losing their license. So that's often done by ordinance, how
It's also their
how-
choice.
how they would
Yeah.
lose a license.
Also
yeah.
their choice if they're going to issue a fine or not.
Yeah,
So, we see that Amory issued 2. Frederick did, Luck Police Department also fined the seller. We don't know if the other ones, if they can reach back out to us, but it's their choice, not ours.
Yeah.
to issue a
so,
citation.
okay.
So as Tanya just explained, citations were issued in those jurisdictions as confirmed by law enforcement. And all police municipal departments were notified of the failed checks. And we worked with them to kind of determine that process of how they wanted to be notified, whether that was a phone call right away or a follow-up email at the completion of their jurisdiction, however they wanted that information to be communicated with them. And based on how tobacco went, we can skip over the next slide.
Jason, I promise not to give you a hard time.
All right, so next steps moving forward is sharing these results again with the municipal leaders. But again, they have this information. They are the license issuers, so we want them to, of course, be informed. We want to work with them. We're going to communicate the results to the community through a press release, social media, and community partner connections. And then we are going to continue to provide community education surrounding underage drinking through schools, partners, social media, the Tavern League, and community events. We do also send information with the letters when we notify the businesses whether or not they passed or failed the checks. For those that did fail the checks, there is additional information on checking IDs and the age laws, as well as potential repercussions of not following those laws. And then we are going to continue to conduct annual compliance checks. Again, this was our first year doing on sale or bar tavern establishments as well. So we're going to continue to refine that process as well. And then in 2025, we can begin looking at data patterns, as this is kind of a baseline since it's changed. So we can't really compare to last year how the alcohol checks went, since they were different this year with being in the municipalities and also including those taverns. Yes.
I just have a quick question. So with the taverns, when they went in, did they attempt to like buy a drink to sit at the bar and drink it, or buy off sale?
So they did order a drink there. The way that it worked is I witnessed them go into the establishment with a set amount of money. What they did is they ordered a drink. It was, if the transaction happened, it was given to them. They sat there for a few minutes on their phone and they took a picture and sent it to me. And then they were instructed to go to the restroom, dump the drink, leave it on a table, and come back out to me.
Interesting. Any other questions? Pam?
So your third bullet point, is like provide, additional education. Can you just kind of, is that specifically like pamphlets type education, or they're actually going and teaching in schools and even like a community event, like working with the Tavern League? I know the Tavern League does stuff on their own, but I mean, what do you guys specifically do as far as your community education? Can you just give me an example of what that really looks like?
I'm gonna tag in Caroline for that.
Yeah, so we always advertise to the schools that we are here to, provide that education directly or provide them resources to provide that education to their students themselves. There's a lot of there. I'm gonna point out the Wisconsin Alcohol Policy Project. This is an organization run by legislators in Wisconsin, and they have a plethora of resources on how to target underage drinking and alcohol misuse broadly. So side noting that for if this is something you guys are interested in pursuing further, really cracking down on underage and underage in Polk County. That's a great resource where we can start. We do social media, campaigns, yes. So we will be sharing the results of this as well as sharing information with parents and guardians on how to start those conversations with their kids about drinking. It is recommended now that they start those conversations around age 8, just due to how they are exposed in this county. Through community events, we also hold resources and things like alcohol cabinet locks, medication lock boxes to kind of help start that conversation with community members. And that kind of brings them into us explaining to them, back in the day, it might not have seemed like a big idea to start giving your teenagers like a beer or two here and there, but we now know that that adds up and that there are going to be things down the line because of that. And so generally we have to move at the pace of our community because there's a community norm in Polk County that is largely alcohol centric, drink Wisconsinably. And so we're kind of moving at their pace, trying not to push them too much, but doing what we can and starting those conversations where we can to help start pushing that community norm, pushing it back and saying, let's protect our kids until they're of age to make that decision for themselves, knowing all of the consequences.
Right. So other than social media though, what's an event look like? That was kind of the questions, like community events. So are you at, like a county fair? Are you at Wisconsin, the Freedom Fest? I mean.
Yeah, everywhere that we are.
But are you? That's the question. I mean, what is, that's the question is, are you there?
Yeah.
I don't know. That's why.
Parent teacher conferences, we do flyers and pamphlets at the fair.
Okay.
We do.
So you have a booth at the fair then?
We're tied in with the public health.
Got it.
So
Okay.
anywhere you see like a Polk County Public Health table, that's us doing that. And that's we get invited to different events that pop up. And like she said, parent teacher conferences.
And service days, we do a lot of teacher education.
And then
cool.
we partner with Partners for Recovery and Community Referral Agency and different nonprofits throughout the county as they hold events too. They invite us, like the Mental Health Task Force.
Okay.
We work a lot with our behavioral health partners.
Cool. Thank you. Yeah, it was just like, what does it really
The
look like?
Lionheart event.
Yep, and
as well.
so like Felicia and I are about to run off because we're hosting we're starting up a youth group in St. Croix Falls, their middle school for 7th and 8th graders, and it's kind of like advocacy focused, but essentially us helping them
Be peer leaders.
And so our upcoming topic is alcohol and tobacco. So we'll be providing them with resources. And then as a team, we'll be deciding how do we best want to get this information out to your peers? What would that look like so that they would.
Thank you. Yeah, appreciate that.
Yeah.
I just have a quick question or comment. So 20 years ago, there was a lot in the schools, and this is maybe more of a sheriff's department thing, but there was all the DARE programs everywhere. And kids taking pledges not to use drugs or alcohol or tobacco or whatever. Is that something that is just you don't hear much about that anymore? I'm just kind of wondering.
So DARE was.
So it has been proven through evidence-based trials that the DARE program is not necessarily effective because it's considered a scare tactic. And so in moving forward in education today, we stray from that. And it's been found to be more effective in the long run. with in terms of just reaching the students and having them actually understand rather than just being scared and not knowing why, but equipping them with the knowledge to make those choices for themselves with knowledge and education behind it.
Thank you. Yeah, I just kind of wondered, you don't hear much about it anymore.
But we are still we're engaging throughout the past 2 years, our relationships with the schools have just gone up and up in terms of how we communicate and how they like to engage with us. And so we're always offering them different opportunities, whether it's for us to come in and speak, like I said, or just helping them create that curriculum. And more schools like Unity just got an AODA position. So they have an AODA coordinator who's working with students who both are already using, but then they're looking at that prevention side as well. And so more schools are starting to have those positions pop up with state funding to kind of come in and be like that DARE program, but from a different perspective that we found that's actually more effective.
Thank you.
AODA.
Alcohol and other drug
Abuse.
Yeah.
Okay.
Sorry.
That's okay.
Yeah, in relationship with the schools, Caroline helped to create the first ever youth summit that we held, which there's a lot of focus on like helping the youth focus on like positive future outlook and making good choices to get to that. So encouraging like successful futures. And I feel like that was a big success too.
So Northwood Tech, for example, they bring in their mobile labs, which are super cool. So students can kind of get a feel on what it's like to be in that field. It's a lot of blue collar career work as well as like healthcare. So like if they don't see themselves like, why do I care about school? Like it doesn't matter, but like, oh, if I stick in this, I could learn to weld later, or, building all of those protective factors around the student so that they're more likely to have a.
We're also looking to partner with Hazelton this spring too, to run a youth group, a 6-week youth group.
Oh, that's good.
Yep, with an AODA focus.
Jason, I just have a follow-up question on the IDs that were checked. Do you know which ones were just looked at and the seller had to like figure out the math, or the ones that
So
have the scanner that?
yeah, the scanning seems I don't have data written down, but from doing these, the scanners seem to have a 100% success rate.
Okay.
When retailers have the ID scanner and they check it.
To me, if they scanned and it said, don't sell.
They do
They
it.
still.
That has happened.
That has
back.
happened. So in 2022 and 2023, when we did our tobacco compliance checks, we had 2 retailers that scanned and it said under 18 and they still sold to our youth.
Jeez.
Like they apparently thought their computer was broken or.
Yeah. I was in the store with them and like you hear a big like when you scan it and they're like, okay, here you go.
Wow.
But I haven't had that issue with alcohol in the last 2 years that I've done this.
I don't know, does bars have the scanners? I suppose some of them do.
I don't believe most of them.
I have to say college towns maybe or something, but around here. I've never seen it.
Some of your bigger, your bigger chain stores will have them, but local bars and the smaller retailers are less likely to.
Okay, do we have anything else other from you or questions? Anybody? No, this is very interesting and informative. Thank you very much for the report. Okay, we're going to move on then to agenda item number 11. Rita McKee. Rita, March Suicide Prevention Awareness Presentation.
And this is an awareness presentation because we don't have a February meeting. This event happens in March, and we have Stephen from the Post 278 Legion to share it with you.
Yes,
and
please.
I think handouts were. So we can look at that.
I appreciate the hour that you're giving me to talk about this. My name's Steve Dubois. I'm the Polk County Adjutant Secretary for Polk County, and I'm also the same position for the American Legion of Balsam Lake here. I've previously been their commander and things, but anyway, we are having a veterans awareness for suicide prevention and as the pamphlet I passed out shows, and to raise some extra funds for other veteran services in the area. It'll be a sleep in a cardboard box, basically, kind of event, or a pup tent, depending on how much snow there is. Come rain, shine, or heat, we'll still plan on having the event. So if we have 2 feet of snow, we'll just shovel out some places. And so we're going to be collecting some cardboard boxes for that. I've talked with Andrew Butzler, our County Veteran Service Officer. He is in touch with other suicide awareness veterans organizations in the northern part of the state here. We're going to have, we'd be happy to, it'll be encompassing about a 7-county area, which is a 12th district of the American Legion. So from Duluth down, basically through Polk County, I'll be passing out flyers and advertisements and looking for contributions and donations in the seven county area. I'll be happy to have a information table for you folks on anything county-wise you'd like us to promote. Certainly the alcohol, tobacco awareness thing. Or if you have additional flyers or the local suicide prevention or counseling services, we'll have a table set up for veterans information as well as any of your local information that you'd like. There are currently 11 posts, American Legion posts in Polk County, and 34 within the 7-county area in the Northland here. So it will be at the American Legion in Pine Park. We're going to have a couple of fundraisers, as you saw there, a spaghetti dinner fundraiser on Saturday evening, and then a pancake breakfast fundraiser Sunday morning. And we may have hot dogs and beans Sunday for lunch, depending on how many people are still in the area and are still having a good time. And additional things not listed on that. We're going to have burn barrels. So we'll be requesting volunteers for wood to donate. We found if you burn slats, wooden slats, all the nails melt. And you end up with about 40 pounds of melted slag in the bottom of your barrels, and you can't move them once they're done because they're full. We're all going to advertise also a food pantry drop-off drive-through where local people could drop off food for the food pantry. Of course, we'll be accepting donations, sponsorships. We'll be hitting up all of the businesses in the area and certainly reasonably driving distances. And I'll be asking our fellow Legionnaires in Luck and Milltown and all the way up to Duluth, Superior for contributions. And we'll probably have a silent auction if we get in-kind donations of things, certificates. We'll set up a table for a silent auction. So that's about it. We'll see if there's a local musician that wants to come in on Saturday night, maybe, and strum a guitar. And it's basically an informational, let you guys know what we're doing. Not really asking for any support other than positive support as far as that goes. Any questions?
Thank you so much. I think this is a really cool thing. Just curious though, as far as the funds directly, are they going directly to a homeless shelter, kind of where, or to a specific suicide hotline, or kind of where?
There is a, we don't have a specific, it's veteran oriented.
Okay.
So like our county veteran service officers, there is a county veteran service office suicide awareness kind of group within the VA.
Okay.
And also within homelessness. Downstate, they actually have homeless shelters where other groups that have done this further downstate have specifically pinpointed a shelter, say, and gave them funds directly. We haven't quite got to the specific shelter areas. There aren't really shelters so much up here,
There's
that
Salvation
are,
Army.
I'm sorry?
Salvation Army is,
Salvation Army, something like that, but we haven't nailed down the specific
Where it's gonna go yet.
that's a good question. We should.
shelter per se at the present. But there are certainly some downstate, and of course, we want to keep it locally
Right.
as much as possible. So I'll need to check with
Yeah.
some of you guys to say where you think the homeless shelter area, which homeless shelters are in the local area, and then try to tie that in with the veterans group.
Salvation Army,
Specific.
Luana Bremer.
Pardon?
Salvation Army's.
Yeah, Luana Bremer is the individual at Salvation Army that you want.
So I do have my name and information number on that, and I would certainly welcome any suggestions or ideas that you think might make the event even more enjoyable or profitable, hopefully, that we can help our fellow veterans and those in need. Suicide has a higher prevalence in veterans, but we all know that it is a sort of an epidemic, as bad or worse than the opioid problems that we have. So that's all I have.
Well, thank you, Steve. For anybody have any other questions or comments for Steve? Nope. Thank you for bringing this to our attention about this, certainly very worthwhile event.
And you'll see flyers pasted all over the place now. That's 99% of what's going to get printed. I just need to add a Venmo stamp on it and a QR code to like our Facebook page or something like that. People can.
Dr. Lagus?
Does Polk County have a homeless shelter of any kind?
Use the Salvation.
They use the Salvation Army facility.
Just relocated into county.
Right.
Then there's also a family center in St. Croix County.
Oh, how many beds they have at the new?
In the new one, that I'm not sure how many they created. They took an old community-based residential facility and turned it into a homeless shelter.
Otherwise, we use Grace Place.
St. Croix County.
And Northwoods has a few houses
Yes.
in the county that can house families.
So I will be checking with, working through the county veteran service officer to get those informations where if there's a higher population of veterans in certain ones, you could proportion off perhaps to 2 or 3 different facilities, some of that. Thank you very much.
Thank you. Okay, we'll move on to item number 12 then, our update regarding housing.
Status quo. There's been no
Okay.
new applicants.
Okay. Item 13, our communicable disease report. Helen?
Yes, statewide, it is respiratory season time. So typically this starts in October. So we know COVID-19, influenza, and RSV activity is high. We look at, or just based on like ER use, lab testing, wastewater data. Wisconsin DHS only collects information about hospitalizations. So far since October, this respiratory season, we've had 7 COVID-19 hospitalizations and 20 influenza hospitalizations. Regarding pertussis or whooping cough, total in 2024, Polk County has had 16 cases. The last time we had a pertussis case was back in 2020. So far, knock on wood, we have not had any 2025 cases. So hopefully that's trending down. And then the last topic is the highly pathogenic avian influenza or the bird flu. In December, Barron County had a positive human case. And so far since January 2024 nationwide, there's been 66 human cases, including that one in Wisconsin, and 1 death related to bird flu. So Wisconsin DABCAP, the Department of Agriculture, Trade and Consumer Protection, is the agency that monitors bird flu in commercial animals or private bird flocks. Most recently, there's been a commercial flock tested positive in Burnett County in December, at the end of December. But so far, no activity in Polk County. So we're just increasing that messaging about biosecurity, staying away from sick wild animals. If you do have a domestic animal that is sick, get in contact with your vet. And then dad cap and the vet would work with the animal, and then public health would be working with the people to be monitoring for symptoms and watching that spread.
Yes. Any questions for Helen? Brad?
I have go ahead.
Go ahead.
No,
Go ahead.
Oh, just a quick question regarding the milk pasteurization and the milk dairy testing. Is any of that happening in Polk County?
We have not had any positive tests in Polk County.
Okay, and my understanding is if the milk is pasteurized, there's no need to worry. It's with raw milk.
Yep, that is what we know at this time. Yep.
Correct.
Good to know.
I think just, at least I think I heard you say Burnett County. It would have been Barron County, right? That the commercial flock of turkeys.
No, it's Burnett.
Burnett.
Oh, was it Burnett? Okay.
Chickens, I think. Chickens?
No, it was turkeys.
Turkeys.
And something from a while ago. So I don't know, I guess just the other day, for whatever reason, I believe it was you that gave a talk one time on frogs in the pond.
Yes. Yeah.
So don't ask me why I'm asking for it again, but it popped in my head the other day. So can we have it?
Yes. So the frog and pond analogy is to help understand the difference between like a medical model versus a community health model and what public health's role is. So the idea is if I have a pond and I have frogs in my pond and I love my frogs dearly, and one day I notice that my frogs are sick, the initial reaction is just to take out the frogs, make them well, and put them back in the pond. But if the pond itself is scummy or dirty or polluted, it's not going to do sustainable good to take the frog out, heal the frog, put the frog back in. It's just going to continue that cycle. So we rely on other medical providers, other community partners to pull out the frogs, help the frog specifically. Where public health's role is to look at that whole community pond and say, okay, how can we make our community healthier so that when the frog is ready to go back in the pond, that it continues to be healthy.
What do you do with frogs?
What was that?
No, they would.
Yeah. But then
The pond is healed, the frogs.
Find a different pond.
The legs are.
The other one.
We have lots of ponds.
Yes.
So a follow-up analogy, because this is really like for anything, I mean, not necessarily mental health, right? This is anything. So I'm going to pick on Pam down here now as my partner in crime, okay? Let's say I'm in the pond and the pond is dirty and you take me out, but I'm an alcoholic. Every night, my friend Pam brings me a 12-pack, a bottle of whiskey and a bottle of scotch, and we drink it.
Oh, both of you.
Oh,
Oh,
that's a lot.
I'm
just, I don't drink, so how would I know? But,
George Thorogood spoke there.
but I'm never gonna get out of the pond, right? So if I never get out of the pond, I can't get help. So if Pam is keeping me in the pond, or if somebody is keeping me in the pond, if that's mental health, if that's alcoholism, if that's drug abuse, how do we get rid of, how do I get rid of Pam? And I guess my question is from that standpoint of looking, not being able to get out of the pond, are we, and when I say we, I mean Polk County, are we doing anything that's keeping people in the pond? If that's mental health, alcohol, drugs, whatever it is. I mean, is there anything that, not just this department, not just Health and Human Services, it could be the police department, it could be, I'm not sure how it'd be general government. Jay sits on that committee, so everything would be good, but.
Money.
I guess my question is, I'd like to, come back in, we meet in 2 months again. Is there anything that we're doing as an organization, as a county, that's keeping people in that pond, that we're not helping people get out of the pond, but we're actually helping, we're actually doing the reverse. We're helping them stay in the pond. And I'm not saying we are. I'm just saying, I think every so often, regardless of if I considered the county to be a business, every business should look at itself and say, are we doing the right things? And there again, I don't know what the wrong thing we would be doing is, right? I don't know what that is. I just want us to know that we're not keeping somebody in the pond. If that makes sense. If not, call me, we'll discuss it further.
Can I just make a comment? What you're saying right now makes me think about what Tanya said earlier regarding the crisis, looking more at interventions, prevention ahead. And often our efforts have been, let's address this problem and this problem, and this problem after the problem's already alive and well and a big problem. And so are we focusing enough on prevention?
So I wonder if it would be okay for us to reframe that to talk about what prevention activities are we doing? I don't know that we could actually drill down to say what we are doing that's keeping people. It would be hypothesis. I don't know if we have any real evidence on what is keeping people in that pond versus what we know to be true for evidence-based prevention activities that we're doing. So I don't know if that would be okay for you. And then also thinking like maybe it could go through the Public Works and Public Safety Committee to see what they're doing on their end, because we could only report on what the community services, veterans, and child support are doing through this committee, unless you want us to join up and have the law enforcement partners here in this.
No, it's big picture. I mean, it isn't, and so, yeah, I mean,
we might be able to talk
reach out
about
to,
underlying assumptions.
I know Jay will take it to the public safety meeting.
I would offer to say a way we're keeping people in the pond is what was evidenced with the alcohol and tobacco compliance checks. How are we dealing with those retailers and taverns that are selling? Because if they continue to sell, they're staying in the pond, right? People buying or using. So by not
But I guess that's
that issue.
So that's kind of the big picture. I'll say that's, like the sellers are keeping them in the pond. Now, that's not the county, right? But it's within the county.
Also, we could tap into the CJCC and how they take people and create a new pond with new relationships and networks and support groups, not to go back to old times.
I would even offer there would probably be opportunity to do that with a behavioral health client. So they haven't gotten to that point, right? That they're that deep into the pond.
So I look at 4 aspects: sellers, community members, including kids, their parents, and the communities itself. So what are we doing? Our prevention efforts around those 4 buckets or those 5 buckets, whatever they are.
I think rehabilitation services too. What services are they doing over at the jail, probation?
Yep. Recidivism, all that. Yep.
I think any kind of public education that we can do in all these areas, or whether it's tobacco, drugs, alcohol, I think are worthwhile. Doing the community checks, I think, really brings the community. If you publish all this information in the newspapers, then people realize that, hey, there are people that are doing good work, and there's people that we need to encourage them to become better sellers, better people, and that's good prevention, to keep people out of the pond. And whatever else, there's all kinds of committees in the county that I see that are working on various pieces of this, and it's maybe the health department can get everybody together and say, okay, what else can we do? Keep people out of the pond.
Thank you. Thank you for that. Bill?
Just spin that the other way. What are we doing well to keep people in the pond? I'm not looking at the pond as being dirty water. I'm looking at the pond as being good water. And perhaps there are some bad frogs. I just had a different spin on it. Because I think, why do people want to live in Polk County? Why do they stay here? Is it because of the services that we do provide for them?
Yeah.
You know, you're the county seat here, you know, right in Balsam Lake. So I'm just looking at it from a different
Yeah,
perspective.
yeah, you're keeping the water clean instead of you're
Absolutely.
keeping the frog
So
in the water, but making sure the water stays
Yeah.
clean rather than taking the frog out of the dirty water and saying, hey, we got 100 frogs and 3 of them are bad. How do we get the 3 out?
Yeah.
And I think that goes back to Mr. Norby's comment there, you know, what is CJCC doing for those bad frogs? And that's only one aspect of it.
Yeah, one.
Yeah, different spin.
Thank you.
Okay, well, we have 2 months to think about this. This is a big pond.
I'm gonna come back for that next.
Yeah.
Yeah.
Dr. Lagus, did you have anything you want to comment on?
Services
I have a couple of comments. The hospitalizations and death rates in the nation are down. There was a couple new variants of COVID. Right now we have the big thing that I've been hearing on the Twin City television is that we have basically 4 epidemics going on at the same time still that are not completely controlled. One is COVID-19, second is influenza, third is RSV, and the fourth is norovirus. And interestingly, you were saying that best way to treat norovirus, which is nausea, vomiting, usually through fecal contamination, to wash hands, that the disinfectants are not effective for norovirus. So hand washing is the most important thing. And currently the Twin City hospitals are really full with all these 4 different diseases, and they're not, so they're just being saying, okay, call your primary care doctor and have them try to take care of you, because we don't basically, they're saying we don't have too many extra beds. So it's a real serious situation, both in pediatric and in adult beds. And so it's so that was the latest report from Dr. Mike Osterholm, was that he's been studying this H5N1 for 30 years, and he thinks that it is affecting bird flocks. It also affecting songbirds, various mammals. And there's been a few people have died. There was a 14-year-old in British Columbia who had asthma, died, and there was a 65-year-old person in New Orleans that passed away. But none of these people, this hasn't come to a person-to-person transmission at this point in time. So the main thing that are getting sick are the cows. There are certain receptors in cows' udders that also we have, but so far, the only thing that has happened to these cows is, and the workers who work with the cows, it mainly gotten conjunctivitis, which is pink eye, and that goes away. The cows generally recover. They do transmit. They have the virus in the milk, and as been said before, pasteurization kills the virus in the milk, so the milk is still drinkable. If the cats come by and drink the raw milk, they have a high rate of mortality. And so it's kind of, it is lethal if you drink raw milk and your cows happen to be infected. So far, there's only about 10 states that there's requirement to test the milk in about 10 states of the United States. So far, Wisconsin is not one of those. So he doesn't not think at the moment that this is going to be the new epidemic, but stay tuned.
Thank you for that information, that update. Does anybody have any questions or comments for Dr. Lagus? No? Okay. So our legislative event report. Do we have anything new there? Nope.
I don't think so, just that we're pulling that committee back together or that group back together. I don't know if we'll meet in St. Croix County or if we'll do it here. And then the CAP Community Action through the Wisconsin Counties Association is convening on the 23rd of January. So like I said, if I don't have jury duty, I'm down in Madison that day to talk about crisis services.
You know, the other event that's happening is February 25th and 26th. I'll be down in Madison for the WCA legislative.
Good. Good to hear. Okay, our next meeting will be March 11th. Robin's will be back and Sam by then. So do we have our subject matters for our next meeting?
I'm not sure how it got dropped off of the agenda. It slipped right through me and Shabana, the 2025 work plan. So we
Yeah.
have the draft completed. It's attached to your agenda. This is kind of our shell of our year here, the best that we can predict.
Okay.
So
So we'll be looking off from that. In the meantime, if we have any thoughts on anything we'd like as an agenda item before then, Mo?
Just if you can have the item after a legislative event is administrator update,
Okay,
just so that if something comes up, I can understand the other committees that are meeting and what they're doing.
sure. Yeah, that'd be great. Yeah, good idea. If we have anything else that comes up between now and then, please contact Tanya or Mo or myself. We're looking at getting it on an agenda. Otherwise, we'll work off from our work plan for March.
do you want the nutrition program updates monthly for a little bit, or how fast do you think they'll move on that, Mo,
Safe.
for the nutrition kitchen?
We can provide an update and see where we stand.
Or is that
Or hey, I have it on an agenda. It'll be 2 months before we meet and just see where we're at, maybe. And then if we don't have anything new, we don't have anything new. Okay, that sounds good.
Is there any updates on transportation? Are we still working on that?
Yeah, we've got that scheduled. On the work
Yeah, I think
plan.
that's on the work plan
In July.
in July.
Also,
Oh,
future agenda items, if the committee would like to hear about the 40-day immunization report, which I know you
yeah.
probably do.
Yeah.
And the percentage of students receiving immunizations.
Yeah.
Also, we'd like to give an update on the Wild Rivers WIC, since we're 1 year into that 4-county WIC project. We can put that on for a future agenda item when we've got a little lighter agenda, we could bring the WIC staff in and then the immunization information. So we'll find a spot that looks good to put that information in, if that's what the committee would like.
Yeah, it sounds interesting.
Always riveting information.
Well, it's news to me, so it, oftentimes, so it is interesting.
Well, and also with the, with some of the communicable diseases that have been out there, like what is our plan for if we do have an event in the school or an outbreak in the school, what are we going to do? So we talked about that earlier this year with the measles outbreaks, potential measles outbreaks, and those immunization numbers.
Dr. Laudius?
I forgot to mention that it still is not too late for people to get their flu vaccine. RSV vaccine is available for people, I think 60 and over. And I found out that my Medicare supplement did not pay for the RSV, but my drug plan did. So you gotta be look for resources and I got my RSV vaccine a year ago, and it's supposedly at least good for 2 years and maybe lifetime. So and there are really no antibiotics for that. And I had a colleague's wife a couple of years was very sick for several weeks. Ended up in ICU, elderly. that's your only option. So you got COVID vaccine, flu shots, RSV, you know,
Shingles.
available.
Yeah.
Sure, neurovirus vaccine. No, hang it. Go back. Okay, well, if we don't have anything else, then I'll entertain a motion to adjourn. Okay, discussion? No? Vote? All in favor? Aye.
Hi.
Opposed? And with that motion carries, we are adjourned.
Oh.
Yes, thank you.
Yeah.